Hello, my name is Dr. Ibi. I welcome you once again to this channel, Beyond the Consulting Room. In this video, I want to answer 5 frequently asked questions about diabetes mellitus and hypertension. Number 1, people want to know if they are curable. Is hypertension curable? Is diabetes curable? Number 2, what are the complications or the long-term effects of hypertension or diabetes? Then number 3, what are the side effects of treatment? Number 4, can they be managed on lifestyle changes only without the use of medications? There are some patients who like to bargain, all right, that they just want to try the diet only, the diet, the exercise, and the lifestyle changes without the use of medications, okay? Number 5, are there other treatment options apart from orthodox medicine? Can they try homeopathy, herbal medicine, naturopathy, and so on and so forth? Okay, so these are the 5 questions I want to answer in this video. Now, these are not questions that anybody should try to answer, all right, from personal opinion. Okay, these are not questions you answer with a personal experience. These are questions directed towards some available human knowledge on hypertension or diabetes, which is believed to be the most credible or the most updated knowledge on these diseases, what we call evidence-based medicine. Okay, so number 1, are they curable? Well, based on evidence-based medicine or knowledge available now, hypertension is not curable, diabetes is not curable. So we are supposed to put you on medication to put the blood sugar under check, all right, to control the blood pressure so that they don't lead to some complications. Okay, now, what are the complications of hypertension and or diabetes? They include heart disease or heart attack, stroke, kidney disease or kidney failure, eye disease. Then we can have nerve damage, what we call neuropathy, from diabetes especially. So the goal of treatment is to usually put you on medications to keep this sugar, this blood pressure under check, so they don't lead to these complications. Number 3, what are the side effects of treatment? Now, if we are trying to put you on a medication for a long time, for life, you should be concerned about side effects. So these are legitimate concerns, all right? What are the possible harm that this medication can cause to the human being, okay, because of this long-term treatment? The only thing is that anytime we are talking about treating diseases, we are comparing the benefits of the treatment and the risk of the treatment, okay? So in the case of diabetes and hypertension, for instance, they are the leading causes of heart attack and stroke, which are the commonest causes of death worldwide. So if you are diagnosed diabetes and or hypertension, the decision has to be made by weighing the options, okay, between preventing heart attack and stroke that can lead to early death or delay their onset, and then some side effects you can get from those medications, which are believed to be mild, not very harmful. They can be reversed when medications are switched. They don't happen to everybody. And in the long run, many people will not develop any complications from these medications. So all the time we weigh the risk of not treating the disease, in this case diabetes and or hypertension, which is the risks being heart attack and stroke, for instance, okay, that can lead to early death, and then the risk of treatment, which has to do with this side effects that are very mild and can be tolerated, okay, by many people, right? Question number 4, can they be managed on lifestyle modification or lifestyle changes only? So if we believe that inappropriate diet, a lack of exercise, smoking, alcohol abuse, sometimes stress can lead to what do you call it? Hypertension, for instance. Okay, so if you modify your lifestyle, you eat right, you exercise, you avoid abusing alcohol. If you modify your lifestyle without taking treatment, can you reverse this hypertension or diabetes? Can the disease be eliminated without or managed without the use of medications? Okay, so people bargain with the doctor and promise that they will observe healthy life habits or healthy lifestyle habits, and so they don't want to be put on medications. Okay, now what you should know is that in every major hospital that runs a diabetes or a hypertension clinic, they have a dietitian on their team, meaning that they believe that we have non-drug management or non-pharmacological management and drug management. Okay, so without telling the doctor will refer you to see a dietitian to talk to you about diet. We are going to talk to you about exercise and other lifestyle changes that you need to make. So we know the place, we know the importance of lifestyle changes. Only that we also know the indications for giving you medications. Okay, for instance, if you have your blood pressure 140/90 and above, and then that is hypertension. But in some classifications, even for 130/80, you are supposed to think that your blood pressure is high. Okay, in that sense, you are not expected to be put on medication at that blood pressure of 130/80. Okay, unless there is some threat to some organ like the heart, the kidney, the eye, for instance, or there are some other risk factors that when they add to the hypertension or the diabetes, or the hypertension in this case, I mean, they can increase your risk of having a stroke or a heart attack and so on. Then at 138, you can put some medication. Otherwise, we are supposed to manage you on diet. So there is a place for dietary management. Be aware of that. Okay. So anytime we have to give you treatment, it means that we have found an indication for the treatment. Okay. Now, even in diabetes, there's what we call pre-diabetes. You are not yet diabetic. In that sense, we are going to advise on diet mainly or on lifestyle mainly without putting you on medications. Okay. So there is a place for lifestyle, but when your blood pressure is very high, for instance, the lifestyle might not bring it down to levels that are within normal. Okay, like if your blood pressure is like 180 systolic, okay, and then we want to achieve something like 120, lifestyle might not bring it to that, might just reduce it slightly. We need drugs, okay, to bring it down to that level. Okay, number 5, can you try other treatment options, especially because orthodox medicine is claiming that there is no cure. Okay, so we could say that that is the limitation of orthodox medicine. What if herbal medicine has a cure? Homeopathy has a cure. What if I can blend some things together and they can give me a cure? Okay, now, in a sense, we are saying that, look, the limitation is orthodox medicine, but not human knowledge, okay? But the reality is that what we practice in orthodox medicine is based on what is called evidence-based knowledge. Knowledge that is supposed to be most credible and most updated, okay? So anytime you say orthodox medicine should speak for itself, what you're actually saying is that the most credible and most updated information on this particular situation, in this case diabetes or hypertension, that source of information should speak for itself that it doesn't have a cure, okay? And that we should give other forms of knowledge which have not been tested, which might just be somebody's personal opinion, might just be from somebody's experience, might just be someone's tradition. We should just give that those options of treatments a chance, okay? And that might not be very useful and helpful to you, okay? Anytime you hear of the name of a disease like hypertension or diabetes, the originators of the name, which is orthodox practice or evidence-based medicine, is actually referring to one particular disease that has some particular characteristics. And within these characteristics is embedded the thinking that it is not medically curable yet. Okay, if some other knowledge is being used to manage this particular disease, that is when we say that those treatment options are just treating the names of these diseases, such as hypertension or diabetes, but are not treating the name, the disease itself. Okay, what you should be interested in rather is that if you have hypertension or diabetes, you should be asking yourself, what are the treatment options that are based on the most credible, the most updated knowledge on these diseases? All the time, that is what you should be asking for. The medical condition that I have, for instance, what is being used to manage me, is that the most credible and the most updated human knowledge on this disease? Okay, that is more important than wanting to try different options, experiment on different options, which are not going to be very helpful to you at the end. Okay, thank you very much for watching this video and subscribe to this channel. Thank you.
Presenting 4 life-changing books by Dr. Abraham Amponsan. Positive Health, Health Beyond Pills. Becoming the best version of humanity. What you need to know about medical checkup. The right treatment for the right disease. Visit www.drab.org for your soft copies. And for your hard copies, call or WhatsApp 0548 696904.